If your doctor tells you your blood work looks normal, make sure that these 5 numbers were actually checked. Your standard blood work is built to catch disease and not prevent it. And you don't want to be blindsided by a condition that's been slowly developing for years just because nobody was looking for it. The earlier you catch the disease, the easier it is to reverse it. I'm a longevity physician, and if you're over 35, these are 5 numbers that you have to know. So the first one is high sensitivity CRP. It's basically a marker of low-grade inflammation. And in 54 pooled studies of 160,000 adults with no heart disease, higher high sensitivity CRP track with more heart attacks and more strokes. The CDC and the American Heart Association consider hsCRP below 1 to be low risk, and over 3 is high. And the second one is ApoB. Your standard lipid panel gives you LDL, which tells you how much cholesterol you're carrying, but ApoB tells you how many particles are carrying that cholesterol. Think of LDL as the cargo and ApoB as the number of vehicles. And it's those particles that are getting into your artery wall that drive disease and drive plaque formation. And in the study published in JAMA Cardiology, 390,000 adults were followed for 11 years. And when researchers put ApoB head-to-head with the usual cholesterol numbers, ApoB was more accurate. And number 3 is fasting insulin. Your standard panel checks your glucose and your A1C, but insulin resistance can be developing for years while your blood sugar still looks normal. And that happens because your pancreas is compensating by pumping out more insulin to drive all that excess sugar into cells. And in a Lancet study of about 6,500 people, researchers could see differences in insulin sensitivity as far back as 13 years before diabetes was ever diagnosed. By the time glucose levels look abnormal, the problem has already been building up for more than a decade. And number 4 is Lp(a). Now this number is mostly genetic. It barely moves with diet or exercise, and about 1 in 5 people run high. So you can have great ApoB and LDL and still have high Lp(a). The recent guidelines say that every adult should have it measured at least once in their lifetime. And numbers above 125 nanomoles per liter, long-term heart attack and stroke risk runs about 40% higher. And if the number is higher than 250, well, that risk doubles. And the final number is uric acid, which almost everybody files under gout, but Italian researchers followed 22,000 adults, and the level that best predicted cardiovascular death was only 5.6, far below what's considered normal in gout terms. And in the recent pool analysis, every extra milligram of uric acid tracked with about a 16% more coronary heart disease. So think of uric acid less like a gout switch and more like a dial. This is why for metabolic health, we generally want to see that number below 5 and maybe even lower for women. So if you've never had these numbers checked at your physical, make sure to talk to your doctor about these tests at your next visit.